Hello and welcome. You're watching FI. I am Sonal Mehrotra Kapoor. Now, one of the long-term impacts of COVID, we've talked about it in previous episodes as well, but today's episode has got a lot of people very, very worried. Are you also one of those who's experiencing hair loss post your COVID? Well, FYI, you're not imagining it. It is actually happening, not just to you, but to several people across. It is leading to stress, it is leading to depression in some as well. So we thought it's very important to try and understand what exactly is the link between COVID and hair fall. And of course, we'll get you tips from experts who will tell you what to do in a case like that. So without any further ado, let's get into our explainer. So the first signs of this actually came up when Google searches on hair loss. They went up by almost 8% in just the last 12 months. And doctors started telling us that they're seeing a huge increase in patients who are shedding abnormal amount of hair. But what exactly is abnormal amount of hair loss? A lot of people lose hair regularly, but when does it get really alarming? Let's talk about that. Where hair loss typically starts after recovery in these cases, and it starts between 6 to 8 weeks after a person tests positive. These are all signs, remember, we're picking up from doctors and experts that we have spoken to. In certain cases, it is being seen to be quite extensive and severe as well. People have been known to lose up to 30 to 40% of their hair in some cases. And how do you identify this hair loss? Really, like I said, to understand this, let's give you a brief insight into what exactly is the life cycle of a hair follicle. All right, it basically has three. Up to 90% of your follicles at any given time are in the growing phase. About 5% of the follicles are in the resting phase. And then with a certain amount of overlap, up to 10% are in the shedding phase. So this is the normal cycle of your hair. When this balance is disturbed is when excessive hair loss is to be noted, and that's when it really takes place. And that generally happens when your body gets into a state of shock. A state of shock leads to a body going into a flight and fight mode. But let's describe what exactly is this state of shock. And let's start that by giving you an example. You might have witnessed that you get hair fall when you get fever, when you get infection post surgeries also sometimes, and even stress. That can send your body into a shock. And once it is in that state of shock, then the body only focuses on essential functions. So your hair follicles get into a resting phase of growth cycle, which means more hair will be falling compared to the ones that is growing. So once that is clear, let's try and see what are the kind of hair losses which are commonly being seen in post-COVID recovery patients. There are two kinds essentially that are now being talked about. We look into the telogen effluvium and the Alopecia areata. Now, the first one is basically a form of a temporary hair loss that usually happens after stress, a shock or a traumatic event. It usually occurs on the top of your scalp, and it is, like I said, temporary. So they begin for a couple of months because of a stressful experience, and then they subside automatically as well. Also, now the telogen effluvium is different quite significantly from the other kind of hair loss disorder that we'll talk about, which is Alopecia areata, which basically is a common autoimmune disorder. Often results in unpredictable amount of hair loss. It can affect anybody regardless of age and gender, but in most cases it is seen to occur before the age of 13. Now what happens here is that the immune system attacks the hair follicles. It impacts patches of hair on your scalp, in certain cases in your beard as well, in other parts of your body, and in some cases it might need a treatment to be resolved. Some people and doctors prescribe steroids in that case as well. So you could be facing either of the two kinds of hair losses over here, two kinds of disorders, but what to do about it? Let's ask our panel. So we have with us on the program today Dr.Pankaj Chaturvedi. He's written about it extensively as well. He joins us from Medlinks. He's a consultant dermatologist and hair transplant surgeon. We have with us Dr. Veenu Jindal. She's also a consultant dermatologist from the Max Multi-Speciality Center in Delhi. We have Dr. Dipali Bharadwaj with us, also a dermatologist and hair transplant surgeon. And we also have Dr. Simal Soin with us, founder and chief dermatologist at Aina. let me bring in the first word for Dr. Pankaj Chaturvedi here. Dr. Chaturvedi, we've discussed the kinds of hair loss really, but I've been reading accounts, and I have to tell all of you that when I floated this conversation on Twitter and we told our FI viewers that this is happening, so many of them have written to us saying, well, this is happening to us as well. Is this related to COVID? I'm sure it must have taken you doctors also some time to sort of link the two. What exactly have you learned so far?
I'll summarize in one sentence. There's a parallel pandemic of hair fall going on with the COVID.
Wow.
Right? So, you summarized it very well. Basically, this is all shock-induced hair loss, telogen effluvium. And we know that the hair, they are biologically not an active tissue. So whenever body is under stress, the body doesn't focus on the growth of the hair. Rather, it concentrates all the energy, the blood flow, and the nutrients to the core functions of the body. As a result, we see enormous hair fall typically 2 to 3 months after this COVID. And we are seeing various patients, like, in fact, in my OPDs these days, the maximum patients who are visiting us, they are either because of extensive hair fall or because of certain types of skin rashes.
Right. And this is gender neutral? You're seeing this in men and women?
It is gender neutral, but of course, like females, they have long hair. So apparently the same amount of hair fall is more visible in females.
Let me bring in the other panelists very quickly now. Dr. Jindal, if I can come to you next, some solutions that you can offer at this point to people who are facing excessive hair loss post the COVID.
Yes. So the first and the foremost thing is reassurance. I want to tell all the viewers that if you're suffering with the hair loss, this problem is temporary, and give it 6 to 9 months. Your hair loss is completely reversible. The hair that is shedding right now will come back. The important thing is that diet, nutrition is very, very important during recovery period. And you have to make sure that you eat nutrient rich and energy rich food. Apart from that, trying lifestyle modifications such as meditation, yoga, basically trying to de-stress, also helps it basically brings you on track faster.
Okay.
And a very common sign that you can see once you get to start the hair loss starts recovering and the hair loss starts getting better is that you see small hair of same length on the anterior hairline. So that is a very good indicator that your hair loss has started to reverse now.
So baby hair is what we call, you saying that's a good indicator that you're on your road to recovery, in a say. You can get back all that hair. Let me bring in Dr. Soin at this point. Dr. Soin, then are we essentially saying that the hair loss that we experience post-COVID is basically stress?
So I have to say that, and I must tell you that most of the online consultations, in fact, a very large number that we did during the pandemic, especially in the second wave, was hair loss related. And so one factor, of course, is that post-COVID hair loss, which is telogen effluvium, which is stress related. We've talked about it. But the other thing is also the stress of the pandemic. So we know that any kind of stress can cause hair fall. So that's really been the cause. So stress, because it again, so like we've talked about pushing the body into a fight and flight mode and like a survival mode. So the non-essential functions like hair loss is what actually takes a beating. So that's really what happens with the hair loss story.
You're saying something very fascinating. You're saying you're seeing patients witness hair loss whether or not they've got COVID. It's the stress of the pandemic. You're saying it's the stress of the pandemic that's got people shedding a lot of hair.
So stress will cause for telogen effluvium, the hair loss that we've talked about. So it gets the body to go into the hair to go into a shedding mode. So but normally you have only about 10% hair which are in the shedding mode.
Right.
About 50% go into the shedding mode normally with the post-COVID hair loss. But when you're stressed anyways about things, you will have hair loss, which is what happens typically when you've had typhoid has been well known. Viral illnesses were very well known for causing hair loss. Then nutritional deficiencies, systemic diseases, even stress over long periods of time causes hair loss. So,
and
so
you know,
we found
the thing about stress is that it's a vicious cycle. You get stress. If you're stressed, it will lead to hair loss. Hair loss then leads to further stress.
So that's very interesting.
How do you break that cycle then, Dr. Bharadwaj? How do you break that cycle?
Sonal, as we, I think there are more females on the panel, including you, of course, and we females find it as our crown. And unfortunately, for last 1.5 years, and it seems for next 1 year at least, we won't be able to let our hair down. So yes, we need to reduce our stress, and because if you don't want your hair to fall down, that is the #1 thing. And interestingly, just to add to Dr. Sohain, which she's explained beautifully everything, is that in the long COVID, the other symptoms like dyspnea, nausea, attention, fatigue, all is being labeled to a lot of studies as tryptophan malabsorption, which is a very essential amino acid. So that is what I generally like to suggest to my patients these days, post-COVID or just because of the pandemic, ongoing pandemic, they're having hair fall. So increasing tryptophan and protein in diet is what I've noticed to reduce hair fall tremendously. There's a wonderful treatment which I'm sure all the panelists also do, and I've been doing is PRP, which is platelet-rich plasma. Excellent results for hair fall, acute and chronic both for men and women. And also for us, it's the only procedure which I'm able to do since the pandemic has started is hair transplantation, which we can do the COVID test for the patient, for us and the whole team, and then do the test in a very bubble like
before we move on to hair transplant, I want to address the issue here first. And I do want to tell you this, Dr. Bharadwaj, it's no longer about women. So many men who get stressed because of hair loss in their early years, before or after marriage, the numbers are increasing. And it's become gender neutral now, at least in the experience I have had with people around me, for sure. But quickly, I just want to give in a word to, back to Dr. Pankaj there. So Dr. Pankaj, essentially what I'm hearing from the panel is increase protein in your diet. There are some supplements that you can take at the advice of a dermatologist, of course, not to be taken, just by reading, or not even to be taken just because you've heard it on TV. You have to, it has to be on a case-to-case basis, and you have to listen to your dermatologist. And apart from that, just try and tell yourself that this is temporary. Once you move back to normal life, your hair is, most cases, hair is going to come back.
Yes, most of the cases, in fact, telogen effluvium is a self-limiting condition. But at the same point of time, there are a few patients who go into a chronic phase where for more than 6 months, the hair fall continues and they keep on waiting that, yes, one fine day my hair fall will stop. So if we intervene little early in the form of certain supplements, certain topical solutions, we can actually control this condition within 3 to 4 months of time. And yes, chronic phase is there where the hair fall continues. One thing is also very important, why consultations with the dermatologist are important, because there are a few conditions which mimic like telogen effluvium, but they are not telogen effluvium. They are something different. Like, for example, there is a variety of Alopecia areata, which is diffuse in nature, where you do not see typical coin-shaped patches. We just talked about Alopecia areata, which is autoimmune condition. So this diffuse variant looked like Alopecia areata, but actually it is not. Also, patients who already have some hair issues like male pattern hair loss or female pattern hair loss, they are at more risk of losing hair.
I see.
So in those cases, yes, they are taking the treatment, they are responding very well, they're fine. But after the telogen effluvium, they lose substantial number of hair, like more than 40–50% hair loss. So prompt treatment is very, very important.
All right, I wish I had more time, but we leave it there. Thank you all for your perspective on what to do when you're losing hair post-COVID. Well, it's a stressful time, but try and keep calm and stay in touch with your dermatologist. I think that's the best way to move forward. Thanks so much for watching. Goodbye for now.